students, today we are going to discuss about the hemolytic uremic syndrome. Hemolytic uremic syndrome may be associated with the Shiga toxin or the bacteria, and the most common bacteria is the E. coli. E. coli produces the Shiga toxin, and the hemolytic uremic syndrome, which is caused by this Shiga toxin, is called Shiga toxin associated HAS or hemolytic uremic syndrome. The second one is the complement mediated hemolytic uremic syndrome. So today we are going to discuss about the Shiga toxin associated hemolytic uremic syndrome. If we talk about the pathogenesis of this disease, the hemolytic uremic syndrome is caused by the Shiga toxin, and this Shiga toxin is produced by the enterohemorrhagic E. coli, and the serotype is 0157 colon H7 is the most common type, which is responsible for this kind of disease, which we call hemolytic uremic syndrome. And beside this, the other serotypes related to the E. coli may also responsible for this disease. Now what happens when the food, basically the source is the food of this bacteria, and we consume the food which is infected with the E. coli, particularly of this serotype. When the food is taken infected by this bacteria, this Shiga toxin is produced, and this Shiga toxin is usually absorbed by the intestine. When this Shiga toxin is absorbed by the intestine, it binds to the GP receptors. When it binds to the GP receptors, there is expressed a product which we call GB3, and GB3 which is expressed in kidney and brain. So GB3 is expressed and in kidney and brain, and this is also expressed in the platelets. So what happens, this Shiga toxin is absorbed by the gut epithelium. When this Shiga toxin is absorbed by the gut epithelium, this basically binds to the GP receptor, and GB3 is expressed in the brain and kidney and platelets. So what happens, the platelets are activated by the expression of the GB3, the platelets are activated, and these activated platelets are usually responsible for the aggregation of the platelets and formation of the microthrombi. Because of this formation of the microthrombi, there is found the thrombocytopenia. So this is the pathogenesis in brief about the hemolytic uremic syndrome. Now, beside this, there is increased activity of the complements, and increased activity of the complement leads to injury, endothelial injury, and this endothelial injury is also responsible for the formation of the microthrombi. So activation of the complements, production of the Shiga toxin, and Shiga toxin associated binding of the GP receptors, Shiga toxin binds to the GP receptors, and production of the aggregation of the platelets and microthrombi formation. So this is the brief about the pathogenesis of the hemolytic uremic syndrome. Now, what about the clinical features? When we discuss about the clinical features of the disease, usually patient presents with the pain abdomen, diarrhea, vomiting, and this precedes to the HAS or hemolytic uremic syndrome. After some time of this presentation, there is end organ involvement, and mainly the kidney and the central nervous system. So when we talk about the clinical features, the patient presents with the diarrhea, vomiting or pain abdomen, and this precedes to the hemolytic uremic syndrome, and end organ involvement like kidney and central nervous system. Now when we do the investigations, usually if we do the peripheral smear, we found the schistocytes or helmet cells we usually found, and there may be the anemia. There is high LDH, decrease haptoglobin, indirect bilirubin is usually increased, and the platelets will be low, and there will be the renal dysfunction. So these are the investigations which we do, and we find these kind of findings in routine investigations which we do the labs, and we find these kind of findings. We also do the stool culture for finding of the bacteria. We do the stool culture. We also send the stool for the ELISA or PCR for Shiga toxin, and serology. We also send the serology against most common this STEC serotypes. So these are the investigation. Now usually biopsy, kidney biopsy is not required for the Shiga toxin associated hemolytic uremic syndrome. Usually biopsy is not required. Actually, when we are supposed to distinguish the disease from other diseases, we can do the biopsy, and in biopsy we usually found the thrombotic microangiopathy picture. So, but usually if we suspect the Shiga toxin associated, or we are confirmed that the hemolytic syndrome is due to the Shiga toxin associated, then usually biopsy is not required. Now, what about the prognosis? The hemodialysis is basically needed in 61% of the cases, and central nervous system is affected in 25% of the cases, and the mortality is 4% if not treated, or overall mortality may be the 4%. If we talk about the treatment, we are supposed to give, number one, the supportive treatment, like we are supposed to give the IV fluid, we are supposed to give packed red blood cells if the patient is anemic, severely anemic. If the patient is severely thrombocytopenic, we are supposed to give the platelets. If we are supposed to control the blood pressure, and we are supposed to do the dialysis if needed. Besides this, we are supposed to avoid the antibiotics, because antibiotics can provoke or increase the disease, but some kind of antibiotics like azithromycin or meropenem we can give, but we are supposed to avoid the antibiotics. There is no benefit of the plasma exchange. In Shiga toxin associated E. coli, there is no role of the plasma exchange, but we can give the eculizumab. This is the monoclonal antibody against complements. So if we give the eculizumab, so there may be the decreased production of the membrane attack complex, and if it is used early, then there can be the improvement. So this is the brief about the hemolytic uremic syndrome, usually Shiga toxin associated. Thank you.